Hi, students, welcome back. We are now on a second lesson for Health 10 Quarter 1 Healthcare Providers and Fraudulent Services. So, in the previous module or in the previous lesson, we have gained information about consumer health, which is needed in making wise decisions in buying, patronizing, and availing any medical or health products or services. Today, the market is flooded with all sorts of food and services which claim to provide instant relief of pain and miracle cure for all kinds of illness to ensure a healthier and longer life. I know you are familiar with this already. So, not all of these, however, are what they claim to be, but because of fraudulent advertising, labeling, and packaging, many consumers are fooled into buying these goods or availing of these services. So, this time, our focus in the discussion is all about health professionals, specialists, and fraudulent health services. Let's start. So, let's discover first the health professionals. So, as we discussed last time, health professionals are licensed to practice medicine. So, knowing each of these professionals and their functions or functions can give benefits such as application of immediate and appropriate treatment, avoidance of time, resources wastage, and the like. So, knowing them will also lead someone to avail of fraudulent health services. So, as a wise health consumer, you should be aware of the different health services provided by these professionals. First, some of these services are a feeding program for elementary children or elementary school children. So this is to address the malnutrition on children. Unfortunately, the Philippines has a high rate of malnutrition, and these programs ensure one meal or one nutritious meal a day. So through this feeding program, it improves children's cognitive development and academic performance. So, studies have shown that children who are well nourished perform better in school. So, these programs also aim to increase school attendance rates. When children know they will get a meal at school, they are more likely to attend. Second, services done by health professionals are immunization for different diseases intended for infants and children from age 2 and above. So, this program is designed to protect children from a variety of preventable diseases, including measles, polio, tetanus, tuberculosis, among others. So, immunization is a crucial part of public health. So, it helps to prevent the spread of diseases and can save millions of lives. So, it's wonderful to see such initiatives in place to protect the health and well being of children. Third, health professional services is prenatal checkup for mothers and babies. So, prenatal checkups typically include regular monitoring of the mother's health, tracking the baby's development, nutritional counseling, and screening for potential health risk. So, they also offer advice and education on pregnancy and childbirth, which can be easily beneficial for first time mothers. So, these services are crucial for detecting and managing any potential complications early, ensuring a safe pregnancy and delivery. So, it's another great example of how the government is prioritizing the health and well being of its citizens. Fourth is the free maternity clinic. So the government has established free maternity clinic across the country as part of their commitment to maternal and child health. So these clinics offer a range of services including prenatal checkups, delivery services, postnatal care, and family. Next is the family planning program. So, our government understands the importance of family planning in promoting the health and welfare of families, particularly for women and children. So, the program includes a variety of services such as counseling, education, and access to contraceptives. So these services aim to help individuals and couples make informed decisions about when and how many children they want to have. So family planning is a vital aspect of reproductive health and plays a significant role in reducing poverty and improving the quality of life. So it's great to see such programs being prioritized. So, health services consist of medical professionals, organizations, and healthcare workers who provide medical care to those in need. So, a healthcare provider is an individual health professional or a health facility organization licensed to provide healthcare diagnosis and treatment services, including medication, surgery, and medical devices. So, examples are doctors, nurses, nutritionists, physicians, and the like. So, here let's discover physicians based on their area of of specialization. So first, we have the pediatrician. So pediatricians are specialized in children's health care and treatment of diseases. Psychiatrists specialize in diagnosis and treatment of mental disorders. Obstetrician specialize in care of women during pregnancy and childbirth. Next is ophthalmologists. They specialize in the diagnosis and treatment of eye diseases and disorders. Anesthesiologists specialize in administering various anesthetics to ensure proper operative procedures. Dermatologists specialize in the diagnosis and treatment of skin diseases. Cardiologists, they specialize in the diagnosis and treatment of the heart and blood vessels. Allergists, they specialize in diagnosing and treating body reactions resulting from unusual sensitivity of food, medicine, dust, and other substances. The pulmonologists specialize in diseases of the lungs and respiratory tract. Urologists specialize in providing diagnosis and surgical treatment of disease of the nervous system. Gastroenterologist specializes in the diagnosis of treatment of diseases in gastrointestinal system. The geriatrician specializes in the care of the elderly and the diseases that affect them. Surgeon specializes in performing a surgical operation in treating diseases, injuries, and deformities. Urologists specialize in diseases and abnormalities of the genitourinary tract. The gynecologist specializes in diseases and care for the female reproductive organs in analyzing images such as x-rays to help diagnose, monitor, and treat various conditions of injuries. And lastly, the radiologist specializes in analyzing images such as x-rays to help diagnose, monitor, and treat various uh, conditions or injuries. Another services provided by healthcare professionals are healthcare facilities. So these are places or institutions that offer healthcare services. There are different types of healthcare facilities. We have discover we have hospitals. So hospital, it is an institution where people undergo medical diagnosis, care, and treatment. So in the Philippines, there are two classifications of hospitals. We have general and specialty. So general hospitals have complete medical, surgical, and maternal care facilities. On the other hand, specialty hospitals handle a particular disease or condition or deal with only one type of patient. Next is walk-in surgery center. It is a facility that offers surgery without without being admitted to the hospital. Next is healthcare center. It is a facility that caters to a specific population with various health needs. Extended healthcare facility, a facility that provides treatment, nursing care, and residential health services to patients, often the elderly. Next is health insurance. So we discussed this on our first lesson. It is a financial agreement between an insurance company, an individual, or group for a payment of healthcare costs. So examples are PhilHealth and other private healthcare plans. Now let's just cover the fraudulent services. So consumers receive health information, products, and services from various sources. Thus, they may be prone to fraud. So an example of which is quackery. This is very famous here in the Philippines, often described as health fraud. Quackery is an advertisement, promotion, or sale of products and services that have not been scientifically proven safe and effective. So it is being operated by a quack, a person who dishonestly pretends to have a medical skills or knowledge. So be careful with this. So there are three major characteristics of quackery. First, it is a big business. It multiplies and spreads fast, so it is progressive. So it also claims that it is for incurable conditions. So quackery or promotion of fraudulent or ignorant medical practices, there could be several reasons for this, especially here in the Philippines. One of the reasons could be lack of access to affordable healthcare. So many people may resort to cheaper, unproven methods of treatment because they can't afford conventional medical care. Another reason could be cultural beliefs and traditions, especially here in the Philippines. Some people may prefer traditional or alternative medicine over modern medicine due to their beliefs or upbringing. And lastly, other reason could be lack of awareness or education. Lack of education about the dangers of quackery could also be or contributing factor. So without proper knowledge, people may fall for scams or dangerous treatments. So as a wise consumer, for you students, you have learned this, so you should be wise, should be careful with this type of health services. So possible effects of quackery: first is taking a quack or cure may delay or lose a chance to be healed. Second, the person may experience a placebo effect, that she improves for natural reasons and not because of the substance that the quack provides. A loss of money, diba? Giving false hope to the sick person and the family. Other is the actual damage done to the individual by using fake products and services. And it may cause overdose and over medicines. So there are three forms of quackery. First is the medical quackery. So it includes cures, treatments, and remedies of various health conditions that are drugless or bloodless in nature. Second is nutrition. Nutrition quackery involves the promotion of food fads and other nutritional practices that claim to be all natural. So these are believed to have beneficial properties of multiple plants in one product. Third and last is device quackery. It makes use of the miraculous gadgets such as dials, gauges, electrodes, magnets, and blinkers that are believed to cure certain health conditions. So as we end, remember that selecting the correct health provider can give the health consumer the advantage of receiving the accurate and appropriate medical treatment. Having the knowledge of the different health providers can also protect the health consumer from fraudulent health providers such as quacks. And that ends our lesson for today. Thank you so much, students, for watching, and I hope you learned something.